Warning: the following program contains content and language that may be inappropriate for younger viewers. There are graphic depictions and portrayals of addiction that will be shown. Parental discretion is advised. Hello, I'm Steve Kendall. I'll be your host for WBGU-TV's new series about addiction. In this series, we'll be focusing on addiction to prescription opiates and the gateway that has led many to heroin. In the past decade, addiction to prescription opiates has emerged as a very serious problem in our community, tearing families apart and claiming an average of 5 lives a day in Ohio. WBGU-TV has made a commitment to help save our community. In this series, we will talk to many people that are on the front lines of this issue, family members, recovering addicts, doctors, therapists, and many more that are all playing a vital role in the state of our public health. While many are just finding out that there is an epidemic, others are in the trenches searching for answers and trying to make sense of it all. People are asking questions, and we're here to help you connect the dots. We now present part 1 of our series, Addiction, Heroin, and Pills.
Heroin has been used in the United States for a very long time, a couple hundred years at least. It's a drug that produces an intensely pleasurable experience when it's taken in the kinds of doses that people abuse. It can be snorted like cocaine. It can be smoked. It can be injected. When it's injected, typically we're talking about intravenously. Opium is the substance from which heroin is synthesized. Opium has been around for a very long time and predating heroin.
The reality is we can go back to the history of opiates in the United States that dates far back, even to the day of the Asian railway worker. And when they came, there was no issue with them using because it kept them productive. They may have been tired, but they certainly worked through it and progress was made. So when the outcome was something that benefited everyone, there was no problem with it. Well, then there was some suspicion or concern, I should say, that, oh no, the Asians are infiltrating, white America, and they're infiltrating, the even urban housewife, and it's making her do things that she shouldn't do. Well, then doctors actually started prescribing opiates to the housewife for her hysteria.
Heroin was actually manufactured first in Germany by the company Bayer, like Bayer aspirin, and it was made to be a perfect drug for pain. And it was didn't take too long before they understood that it was very addictive, and so that changed its profile.
So what initially started as a drug that came over with the Asian community, and then you have the irony of men coming back from Vietnam who are addicted to opiates and continuing to use once they're here. You were still talking about an urban demographic population and primarily African American. Well, what we've experienced with this most recent influx is young people in suburban and rural America who are becoming addicted to pills because they're either doing what, and let's be very clear, young people are doing exactly what young people do. And so what normally a kid would go to a high school party and they'd say, oh man, we're gonna drink a beer or we're gonna do a kegger. Now you're hearing, oh, we have a bowl full of pills and I got them from the death of my grandparent, or my mom had a whole bunch of extra pills. And so we're gonna dip into it and you take one and you take one and then we're gonna chug after, without very clear understanding that that one pill can kill you.
An opiate is any psychoactive substance, any drug that affects how you feel by affecting your brain when that drug comes from the poppy plant. Poppy plants are grown in various locations throughout the world. A lot of them are grown in Afghanistan and that region, and they are turned into heroin or other opiate medications. Some of them are prescription medications, and these are the things that people become addicted to. Recently, the pharmaceutical companies have become able to produce substances that are very similar to opiates. They act like an opiate in the brain, but they actually don't have any poppy in them. Those are called opioids. So opioids includes all the opiates plus all the synthetic opiates.
In our brains, we have receptors in our nervous system that are finely tuned for naturally occurring opiate chemicals that our brain produces in response to a number of different stimuli, but including pain. It's also involved with pleasure and kind of the natural reward system of our brain.
In the mesolimbic reward area of the brain is the release of dopamine. And dopamine is, you can almost call it the reward chemical or the pleasure chemical. And this is really where the important situation is, that everybody, when they have that surge of dopamine is different for different people. And the memory of that, the conditioned association, is different for different people. So some people remember that surge of dopamine and the reward, in a sense, that it created. So they go back for more.
As we take more and more of the medication, our nervous system adapts, and so it develops more and more receptor sites. And as then the medicine is there to fill those receptor sites, you need to build a tolerance, and so we need to take more and more of the medicine. And so it's not uncommon to hear, as one friend of mine said, yeah, I used to take Vicodin, and once a day, and it was really helpful. And then like several months later, she says, I have to take 3 Vicodin for it to even touch my pain. Same pain, but she needs to take 3 times as much in a short period of time in order to get the relief she was getting earlier. And so that whole tolerance occurs with the brain developing more receptor sites. Well, then when you withdraw the medicine, then there is the experience of the withdrawal symptoms.
Now, withdrawal is something that occurs once your body is used to an opiate medication, and it's tremendously painful and uncomfortable. It can cause shaking, vomiting, diarrhea, sweating. It's like the worst fever that you've ever had. So in order to avoid going into withdrawal, people are left to their own devices.
The body goes into this state of mass confusion. So you'll see people who literally are crunched over in this excruciating fetal position because they feel like they're going to die. The difference is they won't, so it's torture.
Last time I withdrew, it was so bad that I had to crawl to the bathroom multiple times a day. And diarrhea is like hand in hand. It's a painful diarrhea. It's not even like a normal, I've got a stomach flu. It's like, I don't understand how water coming out of my butt hurts so bad. In order to stop feeling sick, you know what you have to do, so then your body's telling you, hey, man, I'm sick. We need to do this in order to make it through.
It's like the flu. It's like 20 times worse, But, you know, you throw up, you piss, you shit, you can't move, you're cramped up, you're just cold sweat, and you can't stop.
If it wasn't for withdrawals, I probably would have stopped a long time ago. And the lack of control, not being able to say, okay, today I'm going to do it, and then this weekend maybe I'll do it. It's more of, okay, today I have to do it. 12 hours from now I have to do it. 6 hours from now I have to do it. That's the worst part of it, is not having the control to say, all right, I'm not going to do this today.
Heroin being readily available and low in cost, it's easy then to switch from the medication. Some people use them interchangeably. You know, when they can get a pill, they'll use the pill. If they can't get the pill, they'll use the heroin.
If you're spending $40, $50, $80, $100 a day for one pill to keep you from getting sick, initially you can get some heroin to keep you from feeling sick. And $10 worth may last you a few days. Doesn't take a genius to figure out the economic effects. Well, gosh, $10, $100, this is much better.
These opiate addictions start off very young. I mean, you'll be 14 years old, going to a party, you got some drinks, then all of a sudden somebody busts out a pill, they break it up, and everybody's snorting lines. I mean, that's how people really start, is slowly. You know, they don't do whole pills themselves, but I mean, it's anybody. It's that pretty girl down the street who's a cheerleader. It's that jock. It's anybody will do opiate pills nowadays. There's no taboo against it.
Do they understand that what I'm taking in terms of a pill form is going to lead me to heroin? And the answer is no. If you talk to a lot of these kids in high school, for instance, or even young adults, if you were to go and you were to offer them at a party, say, a syringe of heroin, they would recoil from that. They would say, no, I'm not going to stick a needle in my arm just to have a good time tonight. And yet they're more than willing to go down and have a Skittles party at their friend's house, where everybody goes to their grandparents' medicine cabinet or their mom and dad's medicine cabinet. They pull out the muscle relaxants, they put it all in a bowl, and they pass it around, and each kid takes a pill and kind of sees what's going to happen to them while they're drinking alcohol. So, they think that it's safe. They think that it's a good time. It must be safe, right? It comes out of the medical system. I mean, my mom was prescribed this for her pain. How can that possibly not be safe for me to take and have a fun time with? Their brain figures out very quickly that it's activating those same response signals that give us feedback on things like food and water and exercise, all the natural things that our brain is conditioned to tell our body are good things. They're convinced that the drug is essential for their survival, and they begin this process going from the prescription painkillers toward heroin as their addiction progresses.
From 2000 to 2012, unintentional drug overdoses in the state of Ohio increased by 366%. It's reported that of all these overdoses, roughly 2/3 were related to prescription opiates or heroin.
There's no question that there's a huge early onset, like that 18 to 25-year-old. There is a huge early onset in that late middle school, early high school. And then the next big use age that we see are in that 45 to 60 range. In a rural area, you have more people who have jobs and as a result have insurance, as a result go to see a doctor, and so are more likely to have a prescription or if, because they had health care coverage, had surgery and so on, so would have received a prescription opiate and may have taken them for too long or too many and become addicted to them, and then when they cannot get that prescription, turn to heroin, because heroin is an opiate as well.
It's not anymore what was considered or thought to be by society stigmatizing addiction, a downtown disease. It actually is very much a suburban disease and crosses all lines of race and ethnicity and profession. So the scope is very serious because of the incidence of the overdose deaths, which is happening at epidemic levels.
In the state of Ohio, in 2007, overdose deaths began to eclipse all other forms of accidental death in the state, including traffic accidents and shootings. So for instance, in Cleveland, you're more likely to die of a drug overdose than you are of being shot or being in a traffic accident. It's a very, very serious problem in our state. And we're not alone. It's a problem throughout the United States, but certainly it's a problem here in Ohio.
There are, across our country, 130 people that die every single day as a result of an overdose to opiates. In Ohio, we're losing 5 residents every single day to this disease. So it's a tremendous loss in all aspects. It's a loss of a loved one to a family member. It's loss of workers, loss of taxpayers, loss in our communities, their fathers, their mothers. That it's just a loss, and one that we all need to step up to turn that trajectory.
Me and my baby mom, we got together, and drug is hard, so she was prostituting. You know, I had her out there pulling, you know, tricks, prostituting. But anyways, she comes back, and as soon as she got out the car, I told her I had a surprise for her. And we went to somebody's bathroom. She's setting up her rig, I'm setting up mine. I give her some, she does hers or whatever. I had my back turned. Well, she ain't telling me nothing, because usually she'll say, man, this some good shit, or, you know, this garbage. Well, nothing. So I turn around, eyes in the back of her head, and she falls into the tub. Man, I freaked out. I ain't know what to do. I'm pumping on her chest. You know, it's breathing in her mouth, and like next thing you know, snot coming out. She breathed a little bit, then it like stopped again. So I called 911. They on their way. I've never been that scared in my life. Like I seen somebody die over heroin, and it felt like I did it. You know, because I gave her the stuff. So I killed my baby mom. That's how I feel.
Back in 1970, in the early 70s, when we would talk about people overdosing, we were really specific about that population. So we were talking about 210 people who had overdosed because of heroin or opiate-related issues. 2012, I believe we were talking about 1,917 individuals who had overdosed because of heroin or opiate-related issues. Epidemic kind of implies it's moving at a rate that we can't get a hold of or control of, and it's expanding beyond our means and our resources. I can't say that it's beyond our means and resources, but it's happening at such a quick rate. We barely have time to catch our breath and get together and come up with a systemic approach. But that's exactly what we have to do in order to overcome this issue. We have to look at young people, elderly people who have chronic illnesses. We have to look at family histories, people with histories of trauma. We have to look at urban, rural, suburban communities. So when people say, well, epidemic rates, so imagine those communities I've just identified for you, that on average in the state of Ohio, we are having 5 overdoses per day. 5 overdoses per day is epidemic. If you look up the definition by the World Health Organization, Ohio has reached an epidemic point, as has most of the nation.
10 years ago, we would have an occasional heroin death, but it was pretty much an occasional sort of thing. In 2010, I signed out 8 cases that had died of a drug overdose accidentally from heroin. In 2011, the 8 jumped to 15. In 2012, the 15 became 31. And then last year, we had 80. So we went from 31, almost tripled, to 80. Through October, we've had 123.
At the age of 22, I've known 4 people that have died from opiate overdoses, whether it's from strong pills like Opana or heroin. Parents like to think that heroin addiction is only for homeless people or somebody living under the bridge, when in all reality nowadays kids are starting off heroin when they're 16 years old and they're from upper middle class families. They got everything wrapped up tight in their suburban homes, and you know, these parents just have no idea that it's everywhere. When they go to school, it doesn't matter how nice your school is, sometimes the nicer means there's even more going around because they got the money for it. So, you know, they'll go to school and kids are in their lockers selling drugs.
We're your everyday middle class family. My daughter grew up in a suburb like any other in Pickerington, Ohio. I've always been a working mom. My husband and I have always been involved in our children's lives, their schoolwork, their sports activities, just your everyday middle-class family. When we first learned that our daughter was using heroin, it was because she was involved in a traffic accident. It was a boy that she really liked that introduced her to a whole new group of friends. Because she dealt with self-esteem issues, she made that bad choice. Once she made that bad choice, and once that drug entered her veins, there was nothing else that mattered. We were great parents. She had a great life. And if she were here, she'd tell you. She didn't want to die. But the grip that this has, it is so hard to beat it.
By abusing everyday opiates such as Vicodin, OxyContin, and Percocet to treat pain, a lot of times the path that is taken to heroin addiction is unintended and unintentional. New research has shown a direct correlation between the distribution of prescription opiates and the rate of overdose deaths in Ohio.
The very vast majority of all individuals who abuse a substance, it starts as a result of pain. That can be physical pain or it can be emotional pain. But most of us don't wake up one morning and say, I'm going to abuse a substance. You're trying to solve something. You're viewing that substance as a way to solve something.
The opiate epidemic is an iatrogenic disease. Iatrogenic means a disease that is created by the medical system. Back in the 90s, when we were told that we should treat pain as a 5th vital sign, if you went to a hospital, they would take pulse, blood pressure, respiration, temperature, and then they would ask you about pain. And they started treating pain very easily, and certainly there were very well-intentioned physicians. I think the system intended to be very well-intentioned. But in every group of people, there is the good, the bad, and the ugly. And when pain as a 5th vital sign started to be established and opiates were being prescribed, they were prescribed responsibly and irresponsibly.
If you look at a graph of the sale of drugs like Vicodin and Percocet, oxycodone, hydrocodone, other methadone, other drugs in this class, you see that the number of accidental overdoses is increasing geometrically, very rapidly, exponentially, and the sale has increased at the same rate. They're actually parallel lines. And so for that reason, we believe that it is the aggressive treatment of pain with narcotics that has spread to a lot more people and continues to spread that has led to this problem.
In the year 2003, the state had about 80 million doses of prescription painkillers for 11.5 men, women, and children. 2013, the state dispensed 833 million doses of prescription painkillers in Ohio. So that's for 11.5 men, women, and children. So obviously not everybody's getting a prescription. Not all the kids are getting a prescription. Not every adult is getting a prescription. That's an enormous dosage of opiates that are coming out of our medical system. And what has happened is that there's a direct correlation between that and the number of people that are addicted to heroin. They start out on the prescription painkillers, they end up on heroin as their addiction progresses.
I had back problems and I started taking pain pills. And then before I knew it, I was addicted to pain pills. And then after having 4 back surgeries, I just kept taking stronger and stronger pain pills I started at Vicodin and I went all the way to Oxycontin. And then once you're done having surgery, they eventually cut you off. And then I was cut off from pain pills, and so I started buying those from the street, which became very expensive. And then I was turned on to heroin before I knew it, and I was up and running with heroin.
The problem I see is that it's too easy to have access to the pain medications. And they might be well-intentioned in the beginning, but it keeps going and going and going. In my own personal opinion, we are scared of pain. We think that we should not feel anymore. We should numb everything. And I don't think it's good for us. I think that pain lets you know you're alive and lets you know what's going on. But when they added pain as a vital sign and then tied funding to whether you complain about pain, you see the amount of pain pills just going through the roof. There's simple fixes to it, and I hope the legislature acts on them, but there are simple fixes to those things.
The medical field has every intention of doing the right thing by their client. Unfortunately, with this particular drug, and as I said, all of the other issues that feed into this dynamic, what may seem like the right thing, the risk is too great, and you're never going to establish that within a 10-minute visit at the doctor. And so this person who came in with an injury, got their pills, doctor said you should be through, okay, I'm out, starts using it from other people, and then the story repeats, just like that for the juvenile, for the young person. Now I'm telling you, you can get 1 pill for $80, or I can get you 8 balloons of heroin for $80, and I'll deliver it to you. And if you tell me you never want another batch, I'll say no problem. Take this one, it's on me.
The grip of heroin and opiates is destroying families and communities. The effects on the body and the brain are tremendous. From middle-aged adults, young adults, and even teenagers, no one is safe. Heroin addiction knows no bounds, and 1 dose is enough to hook you for life.
One of the things that I think people need to understand about these drugs is that they will make you do things you never thought that you would do. Most of us have an experience at having difficulty with willpower. I couldn't stay on my diet. I couldn't quit smoking. I started an exercise routine and then I fell off after a few weeks. Take that and multiply it times 2,000. And that's what you're looking at with heroin.
I did everybody dirty. Didn't matter what it was. If I had a chance to take something from somebody that's gonna get me high, I was doing it. You know, if my mom left a purse on the table and there's $200 in it, there's only gonna be $1 left in her purse and $199 in my pocket, you know. I took everything I could. Now, the grip on heroin is like no other grip, and you'll never encounter another grip like that. It's the strongest thing I ever had. You know, it took the jobs, the family, the clothes, you know, my housing. I even sold the shoes off my feet. Drugs took everything from me.
if you can imagine yourself underwater and you really want to breathe, but you have to swim to the surface of the water in order to breathe. You're swimming and you're swimming and you're swimming trying to get there. Getting to the surface to breathe in the water is their next use of the drug, their next fix. So imagine how desperate that you could be to try to gasp for air. That's how desperate people are to use the drug.
The high of heroin is what is so enticing and attractive. I mean, just look at my own demeanor when I talk about it, right? So the euphoria, the high that you get from heroin is like, I want you to think of the most pleasurable, enjoyable experience you've ever had. And you're going to stay that way for hours.
When it gets a hold of you, there's no coming back. There's no willingness to come back. As a parent, you wonder what you could have done differently. Should I have done more? You know? And you'll never know, you know?
Once you get past the denial, because I thought, before I learned about heroin, was that this was just a bad choice that she made. And she's gonna get over it and she's gonna be fine. And then as I read about it and I realized, as I was overwhelmed with the knowledge that her life was never gonna be the same again. And that this was a chronic brain disease and that basically she would be looking at trying to stay in remission for the rest of her life. And that every day was about keeping her alive. And that in itself was very, very difficult. Sometimes it feels like a nightmare, but then I know because she's not here anymore.
We often think of becoming addicted as those people that have used these kind of drugs time and time and time again. What we're seeing now, these drugs are so powerful, so pure as they get to these folks in the street, that even what we have seen one time, people become addicted because of the euphoria that these drugs cause, the strength of this. So it's so dangerous compared to when I reminisce about the 1970s. The power of these opiates now are so strong that we have to be concerned about even experimental drugs. And I think that a number of us that grew up in the 60s and 70s don't understand the intensity of what we're facing out there now with heroin and opiates.
I don't think people realize how bad of an epidemic this is. I think it's, until we start talking, people like me start talking and more people start talking in the communities, and we get rid of the stigma of addicts, what an addict is, we're never going to get past this, because addicts can be anybody. Addicts are, you know, seniors in high schools that are jocks in sports, you know, that get hurt and get on painkillers and then become addicted. Addicts can be just anybody.
Sometimes you think, well, it's just, you know, people that are down on their luck or they're poor. That's not the case at all. There's a lot of people who are struggling with addiction that have taken, they have had everything taken from them. They were a lawyer, a banker, an attorney. I mean, very successful professionals, but they become hooked to the substance. It doesn't discriminate. It acts the same way in everybody's brain. Doesn't matter what you believe, what color you are, whether you're a man or a woman, and anybody can become hooked. It's in the suburbs of Columbus and Cleveland and Cincinnati and every city in between. It's in the small towns and the villages out here in Northwest Ohio that we traditionally think of as kind of just very sacrosanct, almost set aside. But believe me, if it's in a lot of these small rural communities, it's everywhere.
As many heroin addicts resort to crime and other drastic measures to get their next high, it's important to realize that addicts need help. Heroin addiction is a disease. Addicts should always be held responsible for their actions, but it's imperative that the source of the problem not be ignored.
The problem is we're having large amounts of what I call property crimes. They're stealing to satisfy their addiction. I mean, they're not going out to steal to break somebody's house. They're stealing to feed an addiction. Through the court system, I mean, 28,000 people, I did 7,000 cases last year. That's a lot of cases, and we've seen a massive increase in the petty theft. If you look all around it, we're spending so much money to treat the issue and not get to the underlying issue. We're just saying, here, we'll save them today, we'll get them back and we'll put them back out. We don't ever fix the issue. We never get to the underlying issue and deal with their addiction and deal with the problem. We just kind of putting Band-Aids on it.
We've done studies now which show that addiction is a chronic relapsing brain disease, very much like type 1 diabetes and hypertension and asthma. And if you compare the heritability, the relapse rates, the treatment, the monitoring, it's very, very interesting to see that you might as well be talking about the same disease. You might be talking about, instead of opiate addiction, you're basically talking about type 1 diabetes, because they essentially are like mirror images.
We can't criminalize the disease of addiction. And, you know, we always draw the parallel of cancer or diabetes. If I said to you that 40% of the people with cancer that we treat recover, I would get a Nobel Peace Prize. I would get something. But if I say 40% of the people who have the disease of addiction recover, people aren't impressed with that because there's the stigma. They're dirty, they're criminals, they lie, they cheat, they steal. To criminalize them is a lifetime sentence for an action, for a behavior, for a disease that, if we truly treat it as a disease model, they have no control over. The first time you use, absolutely your choice. Absolutely. I'm not sure that the second time you use, especially a drug like heroin, there's that much choice as there is physical drive for the high.
I believe drug-related cases, you know, depending on what it is, you know, it shouldn't be sent to prison, you should be sent to a rehabilitation center.
We're incarcerating too many people. We're incarcerating people that need treatment. We see just about 80% of the people coming to our prisons have a history of addiction. 80%. And those are huge numbers. And they're driving our population up. And those folks that in some cases use illegal drugs in this state, that started out of the medicine cabinet, either their own or their family's medicine cabinet, they are becoming criminals based on our system and not being treated up front.
We have nearly 53,000 individuals in prison, incarcerated in prison in the state of Ohio. So about half that number we accept for less than a year's worth of a sentence, 24,000 individuals. Most of those cases, almost 80% of them, are related to some sort of a drug issue. Heroin has become the lion's share of those people's addictions. And it's getting to the point where the state literally does not have enough beds in the prison system to incarcerate everybody that's getting sent to prison on a heroin charge. And so the state is looking at this and saying, well, what do we do? You know, how do we solve this problem? Because the reality is we send them to prison for 9 months, so we punish them without any treatment to address their underlying addiction. What happens when they get released? They go back and they just do the same thing right over again because they haven't had any treatment for their addiction.
As a society, we have to recognize that this is an illness, and sending people to jail isn't going to solve it. There may be some people who need to go to jail having to do with selling heroin, but overall, the people that we know and care about who become addicted to these medications have a disease like any other. And just as you wouldn't throw a diabetic into jail because they weren't controlling their blood sugar the way we think that they should control their blood sugar, we also shouldn't be throwing heroin addicts into jail unless they're committing bad crimes.
We have to look at these individuals as they are, individuals, and try and come up with a path for treatment that isn't just based on lock them up, but based on maybe lock them up, detox them, get them into treatment, put them back out into the community, hold them accountable, and provide them with supports.
As the opiate and heroin epidemic continues to surge, the sense of urgency is now. With multiple methods of treatment available for those who are addicted, medication-assisted treatment has emerged as being the most successful and effective method of helping people get clean and sober.
In my opinion, if we're going to be successful with this epidemic, we need to create environments where people have the opportunity to get well in a way that they think will work for them when they're ready to do it.
There are a number of different ways for people to get clean from heroin or other opiates. One way is to go into inpatient treatment. One of the difficult things about this opiate epidemic is that our system of care doesn't have enough beds for all the people who are addicted to opiates. When we have somebody who comes into our agency and talks to a counselor for the very first time, the counselor says, wow, you really need to get into an inpatient setting and stay overnight and maybe even stay for a couple weeks or a month. The chances of them being able to get into that kind of a treatment program aren't all that good, even though that's really what they need. We've created these outpatient solutions that in many cases are as effective as going inpatient. And there are two of them in particular that I would highlight that were developed specifically in response to the opiate epidemic. One of them is our medication-assisted treatment program, and that is a program which is capable of prescribing Suboxone as well as Vivitrol. So if you come to our agency, you're addicted to opiates, and we can't get you into an inpatient unit, or for whatever reason you don't want to go into an inpatient unit and you're deemed to be safe to not do that, we will connect you with our medication-assisted treatment program, and you will see a physician as well as an RN, as well as receiving counseling, and that level of care is effective for many people.
10 years ago, we would counsel and counsel and counsel. And you can, I really feel very strongly about medication-assisted treatment because I have seen it, and through experience with treating patients. Counseling helps a great deal in terms of identifying the creation of the opiate addiction as well as relapse triggers and behavioral mechanisms. But medication-assisted treatment has revolutionized the treatment of opiate addiction.
We went throughout the state and we found out that our state has about a 10% success rate for heroin addiction. A 10% success rate. That's a 90% failure rate. But we found that there were some providers throughout the state that were talking about 60% success rates or 70% success rates. And so we began to look at things that those providers were doing. Medication-assisted treatment is very important because it allows people to kind of come down off those levels slowly. They can titrate down on whatever product they choose to use, whatever works for them. And it really helps people with the physical side of that addiction, which is what's so powerful about the heroin addiction. It's not just a mental condition, a behavioral condition, it's also really a very physical addiction as well. Your body is addicted to it.
In spite of the stress and the tragedy that we go through with our clients, we also get to go through the successes with them. And people truly do recover. They really do go from having their lives be a complete mess and being very much at risk of dying to being successful and in some ways able to share inspiration and hope with others.
I never thought I would be able to get off of heroin. I never thought I would be able to stop taking pain pills. I thought that this was it for me. I currently use Suboxone, and that is taken sublingual under your tongue. What it does is it stops the withdrawals. It takes the thoughts away, the cravings away. It made my life livable, functionable. I am, starting to look for a job again. I have my family back. I go to groups, because everybody, it seems like this epidemic is so bad. They're definitely, I don't know if I have the right answer or the wrong answer, but I know that's what saved my life.
I think the medication-assisted treatment, usually it's Suboxone, sometimes it's maybe the long-acting shot Vivitrol, they work differently, really makes a difference in terms of taking away a lot of the cravings. For the most part, they're very safe medicines and they're essential, but they're not sufficient. They need to begin to understand the nature of their addiction and also understand that there is hope, reasonable hope of recovery and what that all entails. And the fact that they will be dealing with this probably the rest of their lives, and there's always the danger of relapse.
We are all affected in one way or another. As we all search for answers, those with addictions need to understand that there is hope. It will take hard work, dedication, and passion for change in order to take back our communities. Everyone has a role to play, and how seriously we all take our roles will determine the future of Ohio.
This addiction is a public health issue in our community and in our state. And the only option for us to provide the safety and security and hope for change is for us all to come forward and do something about it. Everyone has to be empowered, feel empowered, willing to do something, and there is something every one of us can do.
We've won more rounds than we've lost, but if we want to finish this by knocking it out and putting it on the mat, then it involves us working collectively across the state amongst every cabinet and every office. That's the Attorney General and the Governor and his cabinets coming together. That's all of the associations coming together and saying, you know what, here's what we recognize, this is what we need to do if we're going to overcome the opiate epidemic in Ohio. And if everybody is invested with those four goals in mind, prevention, intervention, treatment, and avoiding deaths from all departments, we absolutely can win this fight. But there's a lesson to be learned in terms of how we got here, which is The conversation must continue even after we've laid this to rest.
I believe we're winning in terms of getting the awareness out there to pharmacists, to doctors, to nurses, to law enforcement. We're winning because people are beginning to understand that people who are addicted to heroin are not necessarily losers. That a lot of this is due to the brain addiction, the brain disorder, the brain illness that is the addiction to heroin and other opiates. So I think we're making inroads. Will we eliminate heroin addiction? No, I don't think so. We're not going to eliminate it, but we can significantly curtail it, significantly reduce it. And so I'm extremely encouraged.
We live in a world of instant gratification. You know, you pretty much buy anything off the internet. You know, every commercial you see, there's a pill. There's a pill for everything. And so we've lost sight of those healthy choices and looking at that, like I said, it's okay to feel some pain. And, you know, I mean, this could be a very long conversation going back to doctors not being educated on prescribing, the pharmaceutical companies that keep rolling out the drugs that they want everybody to buy. So, you know, it's a very broad problem that we have in this country. So it's going to take work from the federal level on down to make a difference.
For anyone out there that's on drugs and they're trying to quit, all you gotta do is ask. There's plenty of places that's willing to help, that want to help, you know. But you can't run from it. It don't matter where you go. Suburbs, country, inner city, heroin's everywhere. You can't run or hide from no one, you know. But the biggest thing is ask, and people will help. You know, ever since I started asking to get it off heroin, a lot of people help.
Recovery does work. People do recover.
Don't give up hope. You can get clean. There is life after heroin. Once you get through the withdrawals and you start seeing your life straighten up, you realize there's hope. You know, you'll get your life back. It takes time. It takes time to get your family back. I know if I did it, you can do it. Just ask for help. That's the main thing. You just have to ask and be willing to receive the help that they're willing to give you.
I would be foolish to think that after we deal with this, something else isn't going to come along. What's going to work for now, it's having an approach that crosses systems and crosses boundaries and takes the responsibility off of one system, but is a shared responsibility of every system. Because these could be my daughters. This could be my family. This is our community and we're responsible for it. So we really do have to stop, you know, put our egos aside, put down the idea that I want to be the one who makes the bust, I want to be the one who causes the recovery, I want to be the one who they thank. If you're in this because you're expecting a thank you at the end of the day, thank you. Now get the work done.
Addiction to opiates and heroin is claiming an average of 5 lives a day in Ohio, eclipsing all other forms of accidental death. We are all affected in one way or another. It may not be your family directly, but it could very well be your neighbor, your friend, or your coworker. This addiction is tearing our community apart, and it's our responsibility to pick up the pieces and put it back together. Through programs like the one you've just seen and town hall forums, we hope to bring awareness to this epidemic. I'd like to thank you for joining us for part 1 of our series, Addiction, Heroin and Pills. For WBGU TV, I'm Steve Kendall. We'll see you next time. If you or someone you know is dealing with an addiction, please call one of the numbers on your screen to get help. Recovery is only one call away. You can also log on to the State of Ohio's Start Talking website to get more information and assistance.